The information contained in the SSI Spotlight series is designed for and intended for use by the NCAA membership. The webinar content represents the views and opinions of the participants and does not necessarily represent the views or opinions of the NCAA. The content has been made available for informational and educational purposes only. The NCAA does not make any representations or warranties with respect to the accuracy of the content, nor is the content intended to be a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The webinar is intended for personal viewing only and may not be recorded.
Hello, everyone, and welcome to today's SSI Spotlight. I am Dr. Dina Casiro, NCA Chief Medical Officer and Senior Vice President of the Sports Science Institute, and I am just thrilled to have you join us today for this important discussion on student-athlete mental health during transitions in and out of sport. May is Mental Health Awareness Month, a time dedicated to raising awareness and fostering a deeper understanding of mental health. Recent data from the NCAA Student Athlete Health and Wellness Study indicates a positive trend. Student athletes are reporting fewer mental health concerns compared to the peak of the pandemic, but the work is far from over. The NCAA remains steadfast in its commitment to supporting the membership and your efforts to protect the mental well-being of student athletes across the nation. To that end, today's session will focus on student-athlete mental health during times of transition, both in and out of sport. As you know, mental health exists on a continuum, ranging from mental wellness and thriving to conditions and disorders that disrupt daily functioning. Mental health is dynamic and can be influenced by various factors at different times. We know that periods of transition, whether entering, navigating, or exiting collegiate sport, can increase the risk of psychological distress among athletes. So today we will explore strategies to identify and support student athletes who may be experiencing signs of psychological distress or mental health conditions related to a period of transition in or out of sport. And now I'd like to welcome our guests for today's discussion, Dr. Carla Edwards and Dr. Stephany Coakley. Thank you both so much for being with us today. I welcome each of you to tell us a little more about yourselves, including your role and relevant experience as it pertains to today's topic. Dr. Edwards, let's start with you.
Thank you very much, Dr. Casiro. It's a privilege to be here and to speak about this topic. It's near and dear to my heart and something that certainly I see in practice on a regular basis. I'm a sports psychiatrist. I work with a number of different collegiate athletic departments, and I was an athlete at heart throughout my entire life. So that's what really brought me to this position. And I feel like I have the best job in the world because I have an opportunity to interact with athletes on a daily basis around their mental health in a preventative fashion, in a treating fashion, and over a longitudinal period of time. I am the president of the International Society for Sports Psychiatry. So I get to help folks around the world enhance their assistance for athletes of all ages. And as such, I get to see a lot of different transition points into and out of sport. So I'm happy to be here today speaking with you all, and we'll try to impart some knowledge and support our efforts to enhance supports for mental health. Thank you.
Hi, good afternoon, everyone. I'm Stephany Coakley. I am at Temple University, and I serve as the Senior Associate Athletic Director for Mental Health, Wellness, and Performance. I am responsible, or my team and we are responsible for about 500 or so student athletes, their mental health and well-being. We not only provide mental health services, we also provide wellness services and mental performance services. This is a topic that's so near and dear to my heart. As I studied as a PhD student in exercise and sports science, my dissertation was all about the sport career transition and the sport career transitions that student athletes face. Primarily, it was the exit from sport, but as we know that there are a number of transitions that a student athlete will encounter in their career. So I'm happy to be here, and thank you so much.
Yeah, thank you both so much for that. And certainly we're going to be touching on those different transitions and how it impacts student athletes, and hoping to help our membership with some strategies to get them through. So let's start our conversation with one of the first periods of transition in sport for NCAA student athletes, the transition from high school into collegiate sport. So let me ask you both, what are some of the challenges that incoming first-year student athletes experience in this initial transition into college sport?
Well, I'll start. The main challenge rather, is being away from home. That can sometimes be extremely disruptive for a student athlete, being away from home and everything that's familiar to them, their family, their friends, their social network, their faith communities. Also, the increase in the demand. So that's the first challenge. And then when they arrive on campus, there's an increase in the demand academically and athletically. The competition is often at a higher level and more intense. Their teammates and their practices can be more intense. The obligations to people on campus increases, and they are now responsible for all the communications. No longer are their parents the ones leading and guiding conversations with coaches, etc. Student athletes are now responsible to report to coaches, to sports medicine staff, to academic advisors, to their faculty and their professors, to their administrators, and also communicate amongst their teammates. Aside from the academic and athletic obligations, they are also interested in being more social and meeting new people, and the freedom or independence can sometimes be disruptive because difficulties with time management can cause a variety of challenges for student athletes. And lastly, I think is something that I find often, student athletes aren't really aware that their relationship with the coach, their new coach, they expect it to be the same as the relationship that they had with their former coaches. And when they arrive to campuses and the coaches who've recruited them and who they've known for the longest on this campus, the relationship is not as they expected. That can also be a challenge and thwart their mental health and well-being. So those are some of the ones that I see most common.
I agree with all of those, Stephany. I see those very frequently, and along the lines of those things, understanding the shift for athletes going from maybe being a big fish in a small pond and being highly recruited, highly lauded in their community, to now being a small fish in a big pond, sometimes a very big pond, and having to start at the lower end of the ladder and build their way up. It can have a big influence on their state of mind, their confidence, where they see their role on the team. And that may change as well. They may be a highly valued recruit, but again, once they arrive in that environment, there's going to be a lot of internal competition for those roles. And sometimes folks have to accept a very different role on their team than they thought they were going to have, depending on many different factors. And we'll get into, transfer portal issues and things like that. So the environment they expect to arrive in may be very different than the one that they actually arrive in. And layering that on top of all of the things that you mentioned in terms of adjusting to being away from home and being more responsible for self-advocacy and just settling into a very different support structure, it can have a profound impact on student athletes in their first year.
Yeah, excellent points. I really saw all of those things as a team physician on campus for the past 15 years. And I think you've all really sort of hit the nail on the head with the importance of the environments that these student athletes are walking into on day one, and how those environments, can really shape their experience in their first year. So transferring is obviously another transition that student athletes may experience in sport, whether they're using the transfer portal or they're transferring from two-year college. And even though transfer students have been collegiate student athletes previously, they're still transferring to a new environment with new teammates, new coaches. So I'd love to hear what you all feel are some of the unique risk and protective factors for transfer student athletes.
Sure, I'll start this one off. I've known a number of athletes who have entered the portal or been transferring from a junior college to an NCAA institution, and sometimes they appreciate the risk, and sometimes they don't. And those that do really understand that they're taking a big chance. Are often no guarantees, and the grass isn't always greener on the other side. There's a lot of uncertainty, and sometimes the way they have aligned their expectations, it doesn't play out that way for a variety of reasons, again, outside of their control. So I think they do take a big risk, and it's important for their supports to be able to prepare them for that adequately, if they don't already understand that. In terms of protective factors, I think what they bring with them is experience. And it's important to remind them of that sometimes. They may be transferring because their confidence is shaken. They may not be getting enough playing time, a variety of other factors. So some of that foundational confidence may be shaken, but it's important for them to remember that, they're going to be going to a different place with a boatload of experience that they didn't have before, and that can be in their favor. And in fact, they can bring their own leadership and their own expertise and knowledge to other players that can be quite helpful.
I actually think another risk factor for transfer student athletes is the academic environment that they're moving into, because it might be quite different and it might be more demanding than the one that they have come from. They may also not be able to transfer all of their credits. They may not be able to have the same major. And all of these things can impact the student athlete experience, because if they're studying something that they're not passionate about, that could take a toll on the student athlete experience. So the academic changes that they experience are risk factors. That's a risk that they have to take. You want our student athletes to do the research before they make the decision. But we all know that sometimes timing is of the essence, or time is of the essence, and there's not a lot of time to do the research. And that's where they find themselves in positions that are unfavorable.
Yeah, and I think sometimes now, especially now with the transfer portal, we're seeing athletes not just transfer once, but transfer twice and 3 times. And so really these risk factors are magnified and multiplied the more and more and more these student athletes transfer. So just something for member schools to keep in mind as they welcome transfer athletes, especially those that have been at multiple schools. They may have had multiple different types of experiences at those other schools, both academically and personally. So all good things to consider. Are there certain resources or programs that you would recommend member schools consider as they look for ways to support student athletes in both of these types of situations, both the incoming from high school and your transfer student athletes?
Sure, I think that any programming that we can provide to our student athletes coming into the system is going to be advantageous. So we've talked about summer programming for freshman student athletes, or orientation programs for transfer student athletes, just something to give them a sense of their new environment before they are thrust into their new environment to then either sink or swim. At Temple, we collaborate with our academic support service center to host or to offer a summer bridge program. So all freshmen who are here in the summer, they take about, I don't know, it's like 6 weeks of programming, and they go multiple days a week. And in our department, we are responsible for the mental health and wellness programming for freshmen. And in those sessions, we talk about anxiety, we talked about sleep hygiene, we talk about self-awareness and values-based decision-making, all things that student athletes are going to need to know. And the more they know, the better they're going to be able to manage this transition. We also have energy management as a topic in our Summer Bridge program. And I think the last one that we do in our Summer Bridge program is on effective communication, which is also what I talked about earlier. They're going to be responsible for having conversations with a number of stakeholders on campus. And the more equipped they are to have crucial conversations, I often hear student athletes say, I don't like conflict. And so we have language around assertive communication, conversations that are confident, concise, and clear so that you can get across what you want to get across to the person you're speaking with.
Those are great points. And I think the more we can be prepared for predictable times of need, the better we will be. We already know, we just identified all of the adversities and stressors that incoming students will face in their first year. It's predictable. We can be ready for that. We can build programming around that. On transfer, those students will have some experience from their former institution, but you're right, Stephany, it'll be different, and they'll need to understand and be oriented to the new location. So I think it would be great if institutions could have identified checkpoints, touch points where there will be some screening, some review, an opportunity, opening doors for athletes to understand where their supports and resources are at identified times, certainly at the beginning of each year, and at any change during the year. And we'll get there soon, but around illness and injury, again, predictable. We have research to reflect that those are times of increased need, and any anticipation and prepared programming would be beneficial.
Perfect segue, Carla, into my next question. So the NCAA mental health best practices recommends screening all student athletes for psychological distress at least once a year, working, of course, in collaboration with licensed mental health care providers or primary athletics healthcare providers, and using a validated screening tool in doing that screening. However, understanding that certain events, as you mentioned, or time periods throughout a student athlete's career comes with higher levels of stress, like, for example, around finals. So Stephany, can you talk to us a little bit about how mental health screening tools are used on your campus for both first year and transfer student athletes?
Okay, sure. At Temple, we use the Sport Mental Health Assessment Tool, which is a standardized measure that was developed specifically for athletes. And we've been using that for the past 3 years. And we screen student athletes annually. So when I first arrived on campus, I was a department of one. And so I only screened incoming freshmen and transfers. And then 2 years later, we had COVID. And after COVID, we made a concerted effort to, we made a decision that we're going to screen annually. So regardless if you are a returner, we are screening annually. So if you've been here for 4 years, we'll have at least 4 data points on your mental health and wellness. And so we use this tool and we administer it using our measurement-based system that we use, because we do a lot of measurement-based care at Temple. So all of our tools and assessments are run through the same platform. Student athletes can complete it on their phones, but we're always present, because if they respond that they have suicidal ideation or they're not sleeping or self-harm, we're there to address that person who has been flagged. And we really do this so that we can bring people in before a crisis. So we identify who's either somebody who's green, good to go, yellow, cautions, at risk, and certainly somebody who needs to come in ASAP. And we invite them in for an intake, an assessment, and evaluation to find out what it is that we need to be able to provide for the student athletes so that they can thrive.
Yeah, I love the thoughtfulness around increasing that screening to yearly, and also the thoughtfulness in having folks around while the screening is occurring so that you can respond in the appropriate way. That is directly in line with what the mental health best practices asks member schools to do. So thank you for sharing that with us. Carla, in addition to validated screening tools, what are some ways athletic staff might identify a student athlete experiencing distress during a time of transition, and what signs and symptoms should athletics and campus staff be aware of?
It's a great question, and it's really an important one. Actually, this morning I went to a campus and spoke to incoming student field therapists about this very topic, to know what to look for. And essentially what I told them was, first of all, you need to know your athletes. As you get to know the athletes, you'll get to know over time how to recognize change. So any change that you see is something to really pay attention to. earlier in the years, that's where screening tools will maybe catch some of the things before you get to know the athletes. And again, you'll gain data points as you get to know the athletes further. But beyond that, it's things like changes in weight, either increase or decrease unexpectedly, changes in attendance to sport. When student athletes struggle, sometimes they'll struggle for a long time before they'll let anybody know. And there are many reasons for that, including stigma and fear of sport-related repercussions. However, they'll fight through a lot of things. But when their attendance starts to struggle, when they're late or not coming, that's a really big red flag, I think, because at the very least, student athletes will want to play their sport. They'll come at all costs. They'll, maybe not go to class and start to isolate from their social groups earlier. Those are other signs you can look for. But certainly when you see change in performance, change in demeanor around the team, isolation from the team, or changes in attendance, those are big red flags to watch for. In addition to that, any changes in substance use or substance misuse, changes in behavior, irritability, being more sad or withdrawn, sleep changes, mood changes. And again, you're hearing the word change, right, a lot. So in addition to the screening tools, which will catch things, I really like having somebody present when you're doing that, because I've heard of a few things that are challenging at some institutions. Some institutions will not do screening if they feel they don't have the right supports in place to follow up on the results, which is obviously not what we want to have happen. We want to have something ready to catch these challenges because they are so prominent. But also having somebody there to deal with it instead of months down the road, somebody finally reviewing the results and saying, oh my goodness, somebody was suicidal 2 months ago. I hope it's not too late to intervene. So timeliness, who, what, when, where, how, all very important considerations in screening and also follow-up longitudinally for looking for change.
Yeah, I love that. I think it's also important to have sort of upfront conversations with your athletes about your openness to their mental health concerns, telling athletes it's okay to come forth with these symptoms and these feelings that you're having, just like you would an ankle sprain, right? You have no problem coming forward with saying, my ankle is bothering me. We want to foster an environment where you can also come forward and say, I'm having some mental health concerns. So another time of transition for student athletes can be related to an illness or an injury that results in loss of playing time. Data shows that mental health and physical health are linked, and that student athletes with some mental health conditions, such as depression or sleep disorders, are actually at greater risk of having a musculoskeletal injury. Similarly, student athletes experiencing an illness or an injury that limits participation in their sport have greater risk of experiencing symptoms of a mental health condition, such as anxiety, depression, substance abuse, disordered eating, and so on. So knowing that injury or illness can be a risk factor for poor mental health, what recommendations do you have for sports medicine and athletic staff to help them support student athletes who have experienced prolonged time loss from their sport due to illness or injury? And what signs and symptoms might be an indicator that a student athlete would benefit from further evaluation?
Well, one of the standards here at Temple is that if a student athlete experiences a career or season-ending injury, they are immediately referred to the support. Because as we know, we can predict that they will experience some changes. We don't know what those changes are going to be, but we know based on our experience that they will experience some changes. And those changes will probably be pretty difficult to manage on their own. So referral automatically. Now, nothing is mandatory here, but we are really focused on making sure that our student athletes who are absent from sport and may not be able to return to sport have the supports in place to help them manage that. We often have what we call interdisciplinary care team meetings as well. So on top of the fact that the student athlete might be away from the sport, we as a group, so maybe the coach, the whole support system for the student athlete will gather on a Zoom to discuss student athletes' progress or lack thereof, and if we need to make any modifications to the original plan. If the original plan was counseling once a week, PT and treatment every day, and maybe some accommodations for academics? Do we need to make any adjustments to that plan? I think that at Temple, we have a pretty decent wraparound system for student athletes, and they know that the support is there if they choose to accept it.
I just have to jump in quickly before you comment, Carla, and say I love that automatic triggering of the system when there's been a season-ending injury, because I think that's just a really spectacular takeaway from this spotlight that campuses can consider doing. It's easy enough to institute that type of protocol and probably goes a long way.
We actually, if I might just say, there was a case once where a student athlete had an injury, and they were going to have surgery. And prior to surgery, everybody got on a call, parents included, to make sure that student athlete would have what they need from the beginning of the process, however long the process lasts, to the end of the process.
What a truly supportive environment. That's really great.
Yeah, and we think about it as losses, and the student athlete losing their ability to play a sport for a period of time. We want to ensure they're not also losing their community and losing their supports. We also know that, populations of student athletes who are at greater risk of suicide have even elevated risks beyond that when they are cut off from their support group, and particularly if elements like compulsive exercise are pieces of parts of their illness and may have led to their injuries. So having an awareness of the student athletes, having an understanding of those risk factors, ensuring that they're still involved in some way. Student athletes can have roles on teams even if they're not able to compete and train. So I think thinking outside of the box and being creative and finding ways to keep them involved can be very helpful.
Yeah, I know I keep saying this, but it sounds like a lot of this conversation really centers around the mental health best practices #1, which is creating healthy environments. And in all that you all are commenting on with these questions, it really kind of comes back to if that environment is supportive and also attentive, right? Not reactive, but actually like predicting when an athlete is going to need these services and going ahead and fostering an environment that allows for that to happen quite naturally, maybe without a whole lot of effort on the student athlete's part, can really make a difference here. So I think that's really great. So next, I want to talk a little bit about return to play. A question that we often hear from the membership on this topic of transition related to injury or illness is regarding return to sport. So for many physical injuries, there's already a lot of guidance to support a gradual return to play program after injuries like high ankle sprains or ACL repairs. However, sports medicine staff continue to have questions around return to play for a student athlete who has experienced time away from sport, specifically due to a mental health condition. So, Carla, I'm definitely going to start with you on this one. What are some of the factors that member schools and sports medicine staff should be aware of when considering the gradual return to play for student athletes who've experienced time away from sport due to a mental health condition?
Thank you, Dr. Casero. It's a question and a challenge that has been something that I've wanted to help with throughout my entire career, because I would see, we have protocols for ACL returns. We have milestones that they have to meet. We have measurements that they can do. We know with other injuries, it's very similar in terms of timeframes and expectations, but with mental health, it's very different. Every person is different in their experience of mental health challenges. Because of a variety of reasons. So we can't apply just one recipe to every single person. In my approach to this, I developed a framework which looks at 3 key components: safety, stability, and function. Those components, I think, are elements that need to be considered in removal from play as well as return to play factors. And there are ways to implement that. I'm in the process of developing an approach to that, but I've published on this before. It is very complex, and I think it needs to involve a number of people in determining the return to play pathway, but certainly having a mental health professional involved in that determination is really important too, because they have some expertise in safety, stability, and function. And we have to think about medical stability, psychological stability, and a similar application to safety. And I alluded to earlier function. Function is, again, one of the last things to go in athletes. And if they can't function, including taking care of themselves, taking care of the things they need to in terms of academics and athletics, that is an indicator that they probably shouldn't be in sport at that time. And maybe they need to take some time to stabilize. Most people who have mental health struggles can still compete in sports and train quite well. But sometimes when safety, stability, or function are impaired, we need to make the decision to remove the athlete to give them an opportunity to become healthy enough to return. So in sport, there are some specific unique factors that we need to consider. We need to consider the situation, whether or not the sport was involved in the reason for the deterioration and the need to be removed from sport. If we expect to return the athlete before the situation is addressed and resolved, it will not resolve anything and we'll end up back where we began. We need to consider the symptoms, any active symptoms that the student athlete may have before they return. Are they being taken care of, or is there additional things that need to be considered? Safety, again, is paramount. Safety of the athlete, safety of their teammates, safety of people all around them, and an additional consideration of returning to sport at home, where they will have a different set of resources and the ability to travel. Safety to travel is something that also needs to be considered and ensuring that the coaches feel comfortable, the training staff feel comfortable, bringing an athlete on the road and being able to support whatever may happen. We have to think about sport-specific circumstances. We know that sport is stressful. It brings pressure. It brings adversity. And we need to ensure that a person recovering from a mental health condition who has been displaced from sport is able to manage those things at a level that can be, again, safe and not further destabilizing. And with that, we also need to think about the risk of return. So there's benefit of return. We bring them back to an area that they feel comfortable with. They can build their, again, self-worth, self-esteem, their identity, feel productive, feel healthy again. But also, is there a risk to that if they're not quite ready? So we need, it is a complex approach. Again, we need to think about it from all of those elements, and we need multiple people to think about it, and also a structure to be able to evaluate that before the return, but also in the weeks following it to ensure that the safety, stability, and function is sustaining.
It sounds to me like what you're saying is that it's very individualized and also a balance, right?
Yes.
Between that return to sport and, what additional stresses and pressure that sport might be having on that student athlete. So thank you so much for that very comprehensive answer. Stephany, what practical strategies do you recommend for sports medicine staff and athletic staff who are working to support student athletes returning to sport after time off from a mental health condition?
Well, I think that depending on where they were during their absence, because sometimes student athletes are hospitalized. So depending on where they were, the formula is going to be different. But if a student athlete has been in a hospital, incorporating it's the place that they were, the hospital staff where they were, is going to be very important in the transition back to campus or back to play, because they are the folks who are treating and therefore can make the most reliable recommendations for our staff to then follow. And oftentimes student athletes are hospitalized and they have to be stepped down to IOP, intensive outpatient. And once again, including all of these external clinicians in the process is like, I don't think you can do it any other way. To do it any other way would be setting everybody up for outcomes that we don't want. They may not be poor outcomes, but they would definitely be better served if we were to incorporate all of the treating professionals. So that's my one that I would definitely recommend. And then, as Carla said, just having eyes on the student athlete, making sure that they still have a sense of belonging and community around them, and making sure that they are having their mental health services on campus as well as after they have finished their mental health services off campus.
Yeah, Stephanie, I really want to highlight what you mentioned about that coordination of care, especially after a hospitalization, but certainly even after prolonged absences from sport. From what I've seen on campus and the cases that I've been involved in, by far, not only the smoothest transitions have been when there's been good coordination of care, but it's also less stressful for the other folks involved in that transition back in. So when I think about coaches and I think about teammates, when an athlete returns after a long absence, and I think about the cases where there was this coordination of care, there was a lot of conversation, there was a lot of, okay, this is how this is going to happen, this is what it's going to look like. It's just gone a lot better for everyone. Everybody feels more supported by the transition. So I think that was really, really great. So let's shift now and talk about transition out of sport. So we know that sport offers so many benefits. It can help promote lifelong mental, physical, and social health. It also provides an opportunity to develop skills like work ethic, teamwork, and communication, all of which are skills that student athletes can use throughout their lives and in careers outside of sport. And we know that less than 2% of NCAA student athletes continue on to play professional sports, and therefore most of them transition out of sport and into a new type of career. Now, this transition may occur alongside graduation. It may be a personal choice to retire from sport, or it may unfortunately be a scenario where a student athlete has been cut from a team or suffered a career-ending injury and therefore may have experienced a more abrupt transition out of sport. So what are some of the unique risk and protective factors that student athletes may experience in transitioning out of sport? And do those factors differ for the student athletes who are graduating versus the student athletes making a personal choice to retire versus those who have had the decision made for them?
If I may, I'll just jump in quickly. I think these are great points. I think there are several factors that will determine whether there are risks or whether they are protective factors, and they are common. One being, does the student athlete have an identity outside of their sport being, their persona? Do they know who they are? Do they know who they will be for the rest of their lives? Do they have a community outside of sport? Is there someone else that they can be around when they are not around their team anymore? Have they attained their achievements that they've wanted to in sport or not? Will there be a sense of incompletion? And have their dreams been met or not? And I think depending on how those questions are answered will determine if the transition out is more smooth or if it is rockier.
I agree. And, I want to preface my statements by saying that I want to set an expectation, 12 months. It generally takes 12 months for somebody to move through the transition to what their new normal is going to be. So let's expect for it to be lots of ups and downs and a little rocky for 12 months. Because that first year you don't have preseason, that first year you don't have that first game, that first year you're not playing that rivalry school, that first, these are all moments that a student athlete will probably experience some changes in mood, behavior, or thoughts about themselves. With that being said, even student athletes who feel ready and prepared, they're graduated, they have their community, they have a strong sense of who they are outside of sport, it's still difficult. So I want to say that, but there are a lot of activities and events that student athletes can engage in to better set themselves up and prepare themselves to experience a transition that is less tumultuous. For example, leadership workshops or career development, career readiness workshops. I often encourage student athletes, as in I give them homework in sessions, please meet people who are outside of the athletic department. Please meet people who are not on your teams. You have come to college for 4 years, and if you leave only knowing 12 people or 30 people, you've done yourself a disservice. So going out and joining clubs when they can, sororities, fraternities if they can, engaging in internships if they can, like taking advantage of the whole student athlete experience. We know that their time is limited, but this is important too, because they're only going to do sports for 4 to 5 years, play sports for 4 to 5 years. So we have to give some time and effort and attention to this as well.
I think sport-specific factors can also play a part in that. In sports that have more continuity opportunities beyond their varsity years, like swimming, for example, baseball, they can continue to play those sports for a long time, whereas some sports like rugby, football likely will have less opportunities.
Yeah, I love this conversation around helping student athletes build an identity outside of their sport, right? I think that the stronger they can identify with who they are besides being an athlete, I think that the easier that transition out is, regardless of the reason for the transition. Are there any particular programming or practices that either of you have found helpful to help student athletes build an identity? I know you both sort of touched on this, encouraging them to join clubs and other things, but anything else that we haven't mentioned that you all can think of?
For student athletes who I meet with regularly, during the junior year and most definitely in the senior year, we start exploring values and strengths and doing identity charts and who they are outside and what would you do after your sport, what kind of physical activity would you do after your sport. Let's just say they want to take a break from their sport, but they still want to maintain physical activity. Like, what are some things that you wish that you could have done that you weren't able to do? Now you can do them. Let's think about it. Let's make a plan. So for seniors in sessions with me, we will have a plan. Like, this is the plan for when you're going to see your friends, because you're going to miss your friends. But now you have to take guys trips or girls trips or co-ed trips, like however you want to do it. But let's make a plan for what we're going to do next year, because next year is coming. And we know we can predict that there are going to be some challenges. So let's have a plan in place. So that's what I do, like in individual sessions. But one of the things that we're doing here at Temple is we're piloting a AI-powered sort of like a mentor for student athletes. And it's actually developed by a former student athlete who was one of the first people to benefit from the service in the athletic department. So he felt so moved to like continue to provide things that he wished that he had. So he's created this platform, this online platform, and we just piloted it here at Temple a few weeks ago. And so we're excited about that because that's something that's scalable. That's 24/7. It's something that they can do when like the thought hits them. And his original plan for it was for transition. He's expanded it quite a bit for student athletes transitioning in and at various parts of the student athlete experience. But his original like plan for it was for student athletes who are leaving their sport. And there's also a new platform that I just recently heard about. It's called Second Shot, and that's an online platform. I think we need to think outside the box. Student athletes already have enough programming to go to. So figuring out how we can make these services accessible to them when they feel ready for it. Because when I plan a program, somebody might not come, not because they don't want to or they're not interested. It's because they're just not like, it's not the time right now. But if they had something that they could, at 3 o'clock on a Sunday afternoon, they had a thought about like my life next year when I graduate, and then they can just go online and get the answers to the questions that they have. I think that's maybe how we can serve our student athletes in this transition space. So those are two online platforms that they both exist right now.
That's a great point, Stephany, just the timeliness of the resources. And you're right, student athletes have a lot on their plate. They're already obligated to go through so much programming that it is less about sort of like, forcing them to go down that road, but just letting them know these resources are here for you to access when it is convenient for you. Carla?
Yeah, I love that the tapping into our opportunities electronically these days that we wouldn't have had 10 years ago, and again, understanding what the needs are. I know several institutions that have series of sessions, whether it's having folks come in and talk about insurance and transitioning away from their athlete identity, and just with a number of opportunities to interact with people who've been through it before. So tapping into that expertise. But I really like that offline availability, archiving things, I think is brilliant.
Well, thank you both so much for participating in today's session and for sharing your expertise and your insights with us today. This is a topic, as I mentioned at the top of the show, that the membership has really been asking for more information on, and we just appreciate you taking the time to answer those questions. And thank you to our audience for attending today's session. Don't forget that your certificates of attendance are available. You'll find instructions in the chat for those. Please email ssi@ncaa.org with any questions or suggestions. And remember that registration is now open for our next SSI Spotlight, and we look forward to seeing you there.